Joining us on Zoom, we have Elizabeth. She's a nurse navigator at Billings Clinic's new high-risk breast clinic. We thank you so much for joining us this morning, and we want to know all about the center and why did Billings Clinic decide to assemble it?
Good morning, Victoria. Thank you for having me on this morning. So Billings Clinic was looking at all the resources that we have available for women who are at high risk of breast cancer, and we decided to bring them all into one place so that women can have a one-stop shop, as it were, for their care, and we can make sure that no one falls through the cracks. It's a unique service in the region. The closest high-risk breast clinic is actually, I believe, in Bismarck, North Dakota. So we are really excited to be able to bring this to our community.
And how does the patient figure out if they should be seen there?
So you can have a discussion with your primary care provider assessing your breast cancer risk. And you can also go on our website. We have a few little trigger points to look at there. And some of those would be if you have had a strong family history of breast cancer, if you have ever had a diagnosis of a benign breast lesion that would be diagnosed in biopsies by mammogram, and also a family history of ovarian cancer would be another point to consider.
And I'm also interested in, every time I hear about a young case of breast cancer, so, a woman under the age of 40, if there is a woman younger than 40 out there watching this right now and they are concerned about breast cancer, how do they figure out if it's really something that should be top of mind for them?
Yeah, definitely. So 5% of breast cancer cases occur in women under 40. It's much less prevalent than it is in older women, which is why they recommend mammograms beginning at 40. However, if you do have a high risk of breast cancer, they recommend starting screening earlier depending on your risk. So the best thing to do would be to figure out if you fall under that high risk category.
All right. Well, Elizabeth, thank you so much for your time this morning. We appreciate it, and it's always great to hear about new resources that bring attention to breast cancer and helping out those patients. Thank you so much.
Thank you.
We'll be right back after this break.